In the last video, we looked at causes of miscarriages and when miscarriages usually happen. Today, we'll be looking at how to prevent miscarriages. Again, just to remind us, a miscarriage is the loss of a pregnancy before week 20. It's actually very common and it affects 1 in 4 women who get pregnant. We all know how heartbreaking it is. It can be a very emotional and difficult experience, but it is important to remember and to know that you are not alone. Many factors can contribute to a miscarriage, but in this video, we'll be talking about how to prevent a miscarriage. So, how can you prevent a miscarriage? Let's look at some factors we spoke about in the last video. If you've not seen the part 1 of this video, check the link above here or the description box. The first one is chromosomal abnormalities. I am sure nobody wants to give birth to a deformed child, a child that will have issues in the future. So, sometimes when a woman gets pregnant, the baby's genetic material, the DNA, does not develop properly, and this can lead to chromosomal abnormalities. That makes it difficult for the pregnancy to progress. This can lead to a miscarriage. Most times we cannot do anything about this, but while these issues are often random, there are some factors that can increase the risk, like old age. For women who are above 40 years old or certain genetic conditions, most times there is nothing one can do except to eat healthy and to improve the air quality by taking the right supplements that helps to improve air quality in a woman. Now, the next factor and how to prevent it, I forgot to mention it in the last video. It is the rhesus factor. I mean, negative rhesus factor. Men and women generally have what we call a blood group, like A positive, O positive, B positive, O negative, etc. The positive and negative is what we refer to as rhesus factor. So, if a woman has a negative rhesus factor like O negative and the baby's father has a positive one like O positive and the baby takes the blood group of the father, the woman's blood will likely develop what we call antibodies that attacks the baby's blood cell, and this could cause miscarriage or stillbirth. This is called rhesus incompatibility. So how do you prevent miscarriage caused due to rhesus incompatibility? Once you get pregnant with your first child, you need to let them know at the nearest hospital so that they can give you an injection during your antenatal cycle and after you give birth to prevent you from having miscarriages due to this in the future. So with the proper antenatal care and treatment, this risk can be significantly reduced. The next one is the hormone imbalance. Like I said in the previous video, an imbalance in a certain hormone, like the progesterone hormone, can make it difficult for the lining of the womb to support the growing baby, therefore leading to a miscarriage. This means the baby does not have where to stay. So in order to prevent this, a woman needs to boost her progesterone level very early by eating progesterone boosting foods and also take progesterone prescribed by the doctor. Like I told you the last time, this is the commonest cause of miscarriages. So if you've been having lots of miscarriages, let your doctor check your progesterone level once you confirm you are pregnant, and also check your beta HCG level. The next one I spoke about is cervical incompetence. I said the cervix is the gatekeeper to your uterus, keeping everything cozy inside. But sometimes, due to factors like previous surgeries or weakening of the muscle, the gate might open too early, leading to a miscarriage. So, cervical incompetence refers to when the door of the womb opens at the wrong time, when normally it should be closed due to structural or muscle issues. This can lead to miscarriage, and the way to prevent this is to undergo a surgical procedure called circlage, whereby they help you to close the mouth of the womb and make it closed by surgery. So as a woman, it is important to ask your doctor to check your cervix between week 12 and 14 through a scan to confirm if your cervix is intact. Usually this surgery is best done before you are 16 weeks gone. The next one is infections. Try to treat all infections before you start trying to get pregnant is very important. Certain infections like bacterial vaginosis or untreated sexually transmitted infections can lead to risks of miscarriage. Maintaining good hygiene and taking good care of your body can help to reduce this risk. Then lastly, let's talk about stress. I know you may have heard that a woman had miscarriage because of stress. Most times, it's not totally true. While stress alone does not cause miscarriage, it can actually contribute to hormone imbalance and other factors that might increase the risk of having a miscarriage. Managing stress through relaxation techniques, exercise and healthy coping mechanism is essential for both your physical and mental well-being during pregnancy. On a final note, while some risk factors for miscarriage are beyond our control, there are things to do to improve our chances of a healthy pregnancy. This includes antenatal care. Regular visits with your doctor will allow them to monitor you closely and identify any potential issues early on in your pregnancy. Healthy lifestyle. Eating a balanced diet, exercising regularly and getting enough sleep can all contribute to a healthy pregnancy. Managing stress. Finding healthy ways to cope with stress can benefit both you and your growing baby. Genetic testing. If you have a family history of certain genetic conditions, discussing genetic testing with your doctor might be very helpful. If you have any concern about getting pregnant or your pregnancy, send us a DM or send us a WhatsApp chat for our treatment programs. We are here to support you and provide you with the best possible care. Thank you.